to sculpt.
What are cannulas, by the way?
Cannulas are small hollow tubes attached to a suction device similar to a vacuum cleaner that removes the fat cells. And so we want to obtain a result that is smooth, that is attractive, that people look good not only with their clothes on, but without clothes. So that you get a smooth contour without wrinkled skin, without any lumps or bumps or depressions. And this takes time. This is a small, tedious procedure that gives you the ultimate result.
Okay, now, other surgeons using power-assisted cannulas, bigger cannulas, in your view, not the right way to go.
That's true. I think that the bigger cannulas, you have a chance of making a divot, a depression, not a smooth area. The whole result for the patient is how does it look. It's not what type of machine did you use. There are ultrasound machines now that people sometimes are asking for because there's a big advertisement campaign.
Right.
But they don't really improve the results.
They don't work?
It's more of a hype. And
a lot of gimmicky things out there.
That's true.
About lipo.
And it's also the possibility of them causing a burn with their application to the skin. So the bottom line is the patient has to be happy with that result. It has to be smooth, it has to look natural, and it has to be aesthetically pleasing.
If there's a mistake being made in the world of physicians doing liposuction, what would you say it is, as far as their approach?
I don't think that people have a good eye. They tend to just remove volume, and they don't really tend to take the time to look at the results. What we do in my office is there are 4 people doing surgery with me, and we all have them helping me look at the results, making sure that that stomach is perfectly smooth. And they will tell me it's a little high in this area needs to come down, and I will listen to them so that I don't think of myself as the artist who knows everything. I have the help, but it's helped tremendously in our results. And so I have to just drop my ego and maybe say, I'm not in a hurry, I don't have to go eat lunch, I'm going to stay and take as long as it takes until everybody in the room is happy with that patient's results.
Dr. Schafer, we're going to take a quick break. When we come back, I want you to take me through the process, what somebody could expect when they go in to see you for lipo, and also what are the common areas that men and women are coming in for. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking with Dr. Schafer about liposuction. We'll be right back. You're watching the latest edition of The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Schafer. We're talking about liposuction. Dr. Schafer, men and women, more men, more women, equal?
We actually have a huge male practice, which is very unique for anybody in the world. And actually, when I lecture at various conferences, people are surprised that we do 50% male cosmetic surgery patients.
Okay, now, we'll get to the men second. First, women. What are the most common areas they're coming in for?
Well, just about everybody has a problem with their tummy. So women, when in the childbearing areas, tend to gain the weight more around their abdomen and their love handles and their back.
Easy area to treat?
Very easy. To give people their waist back is very easy. We rarely do a tummy tuck. People a lot of times come in begging for tummy tucks. I tell them,
right?
I tell them they don't need it. They don't need the general anesthesia. They don't need the big scar. I show them pictures of people. Would you be happy with these results? And 99% of our patients are very happy and never have a tummy tuck.
Now, your surgeries, where are you doing them?
We have an accredited surgery center in the office across from Coronado Hospital, and we have 2 operating rooms that are equipped fully.
So it's right there on site,
on a medical campus, equipped just like an operating room in a hospital.
Now, we talked at the break. You get the large patients come to see you. Is that right?
Yeah, we even have patients referred from other doctors who don't wish to do patients of that size.
They're too big.
That's right.
But not too big for Dr. Schafer.
Well, we like to try and help our patients. We like to be realistic, and we take pictures of them before we draw. We show them pictures of people that have had similar weight sizes and what type of results they can expect. We don't want to promise them something we can't deliver.
Sure.
We want to give them a good, honest opinion.
But you're saying that you get athletes as well and models, people that you wouldn't think are getting liposuction or getting liposuction. Is that right?
Yes, we have done quite a few models that have small areas that don't do well on the camera. We've done professional basketball players, we've done Navy SEALs, we've done Marines. A lot of people you think that would be in excellent shape, fitness instructors, and everybody seems to have some type of genetic problem that's not due to diet and exercise that they're unhappy with. And be it large or small, we can usually remove it and make them happy.
Okay, with women, what about arms? How well do they treat the underneath, the flabby arms?
It's funny, a lot of physicians that are doing this type of work do not like doing arms. They're quick, they're easy, they heal in a couple days. The people are happy with results. I've never had to remove any excess skin, no matter how large the patient's arms.
How does the skin bounce back, though? It seems like that loose skin.
It's loose skin, but it contracts extremely well, very similar to a woman's stomach after delivering a baby. And if her stomach contracts 90%, she's happy. If this woman's arms contract 90%, she's very happy. There's a certain age for women where they cannot wear sleeveless dresses or tops anymore.
Okay, they avoid them.
They know that. And so they are so tickled that they can come in and find a solution just for that small problem.
So you could give them that sculpted look on the arm, maybe a tricep that shows.
We can actually get rid of the fatty deposit. If they have the tricep there, we can certainly define it. But what we really do is kind of get rid of the bingo arms. The older women playing bingo that wave their arm bingo, and it shifts back and forth. All that excess fatty tissue that seems to collect in women is removed.
Is this only for the younger patient? Older patient can do this too?
We've had it in younger people where it's hereditary. It's more typical in the older female.
Now, and we talked on the phone. On the back, you're doing lipo on the back as well, around the bra strap area. Common area?
Very common. A lot of people find that the bra strap causes the tissue to bulge above and below it, also in the front. I've also done the back of the neck, the buffalo hump, where certain people have that genetic, and I've also done the back, the neck itself in the back. I had a fellow that had a bunch of wrinkles in the back of his neck, and we smoothed them all out for him. I had never done it before, but I know the anatomy, and so he was very pleased with the results.
What about buttocks? Women, maybe the saddlebag area?
Saddlebag is very common. We like to do the circumferential area around the buttocks, where we define the hips, the area below the buttocks where the crease is, we call the banana area, and then the lateral, the outside of the buttocks. In terms of the volume of the buttocks, we're pretty conservative in reducing that, but it's not unusual for us to take some of the fat for someone that has a flat buttock and to inject up to 500 cc's to give them a rounded contour. And we've now learned that by putting this into the muscle that we get a tremendous take, and the people are happy with the results.
What about inner thighs?
Inner thigh is very common. Most people hate that area, the upper part of the inner thigh that rubs in blue jeans. Very common. We take the incision all the way down to the knee so there's a straight line. A lot of people just do the inner thigh halfway up.